This video is going to be on remodeling and bone repair. So bones grow and remodel and repair themselves all throughout life. You have stress, you have trauma, you have micro cracks, and all these things have to be repaired. Micro cracks and micro fractures can be done just overnight. So for instance, you went walking, hiking, any strenuous exercise, you end up getting these. And at night, you basically repair them. But some of these that we're going to talk about today are a little more traumatic in how it actually heals itself. Typically, depending on age, it's going to either heal in 8 to 12 weeks, and the bone has to be immobilized. So the first step of bone repairs, obviously there's been some bone damage here, and the first thing that's going to be happening is that blood will start to clot in that one area. And we know that blood usually starts with heme, so that's why it's hematoma. So hematoma is basically where you have this crack in the bone and this blood starts to gather in that one area. It's also going to bruise and hurt. Second step is going to be that we start to make that fibrous cartilage, and that is going to be the template of where bone is going to start to grow. So that fibrous cartilage is going to hold the two bones together temporarily, and that's going to be the scaffolding for trabecular bone. So even though this could be a long bone where we don't have trabecular bone in that one little area, we're going to temporarily make trabecular bone. Well, first we're going to make the fibrous tissue cartilage, and then we're going to hang trabecular bone on it, and eventually we'll do the rest of the formation. Step 3 is the bony spongy form is starting to fill in and calcify and get harder. It's still very soft and brittle, so if any weight was put on this, it would crack again, so it still has to be immobilized. Step 4 is, well, if you look at step 3, you can see that there are some abnormal growths on the side, and that all has to get reshaped to come back to normal. So if we look at a bone now, what you're seeing is that a couple of things have to happen. Osteoblasts have to continue to keep making bone and mineralize it. Of course, that makes sense. The next thing that happens is the osteoclast will break down any of that oddly shaped bone and start to shape it into the shape that it should be. You'll notice that this bone is also going to have a thicker outer area, and that's going to stay for a while because it's going to keep supporting that bone. So you can look at somebody that broke their bone years, even decades after, and still localize some of these areas based off of these growths. The other thing I wanted to kind of go back and show you is before we broke the bone, we didn't have a ton of blood vessels here, but you'll see blood vessel formation occurring, and that blood vessel formation is basically to make more calcium come to this area, make sure that our hormones are coming to this area, and really anything to support osteoblast and class. And then let's talk about skeletal diseases and disorders. Osteoporosis is one of them, and it's just being bone gets reabsorbed constantly. So the top is normal trabecular bone, and the bottom is osteoporotic trabecular bone. And basically what happens is bone mass becomes sort of brittle, it starts to become decalcified, and it usually happens in women after postmenopause when hormone levels start to get irregular, and what ends up happening is we start to weaken bones. Even though we might have high amount of calcium in the blood, it still thinks that we have low amounts of calcium in the blood, and the bone starts to get whittled away. You can help this with blood therapy, taking some calcium, but it's starting to show that if you take calcium and you're removing a lot of bone from your calcium from your bone, like you would with osteoporosis, you start to have kidney stones. You can have other issues that pop up too. So there has to be this perfect balance. And usually therapy helps. Exercising when you're younger really helps because your trabecular bone is thicker to start with. The next one is called Rickets, and basically what happens here is it's a softening of the long bones. So you could see with this child, his long bones are curved because his bones are getting a little more curvy, softening, and it's basically because of calcification deficiency. And if you remember back from that picture, we saw some bone without minerals in it, and it got really flexible, and that's what you're seeing here, is the weight from this kid is sort of bearing on the bones, and because the minerals are starting to deplete off, they're starting to curve. It is very painful. It causes bowing of the legs, even if it continues bowing of the spine. Then the last disease is going to be called Paget's disease. This is something that we do see in the U.S. quite a bit. Well, 3%, but you'll actually see it here. And it's caused from a virus, and it's bone deposits and reabsorption happens sort of haphazardly. So like here is a normal tibia. And you can see with this tibia, we have areas that are starting to deform and just sort of form in random places. The shape is completely changing. It makes the bone a lot more weaker and easier to break. The way you treat this is by giving the person calcitronin and drugs to prevent bone reabsorption.